Why do some people get cancer and other people don't? Why are some families prone to cancer and others go untouched? Could there be a genetic answer? And if so, can this cancer-fighting capability be transferred from one person to another? Research by Munogenics has uncovered game-changing evidence of this, and with your help, a new clinical trial may find a conclusive answer. Every year, approximately 600,000 Americans and more than 7 million people around the world will die of cancer. In the US, 1 in 3 women and 1 in 2 men will develop cancer during their lifetime. Our current cancer therapies are invasive and destructive, with well-known side effects, and they are harmful to healthy cells as well as cancer cells. The search is on for less invasive therapies. So we come back to the question, why do some people get cancer and others don't? Cigarette smoking increases the risk of lung cancer 100-fold compared to non-smokers. But many lifelong smokers don't get cancer. Is there some biological mechanism or process that protects some of us from getting cancer, or helps us fight it off before it can multiply uncontrollably? One mouse may have answered that question. One mouse's immune system fought back against the cancer. Researchers at Wake Forest University unexpectedly discovered innate cancer immunity in a common laboratory mouse. A group of mice were injected with soft tissue cancer cells, with an expectation that all of the injected mice would develop cancerous tumors and die. However, one male mouse failed to develop tumors and remained healthy. This unexpected mouse possessed the innate ability to resist even repeated injections of cancerous cells. And the offspring of the mouse showed a high rate of this same cancer-resistant trait. During one trial, 22 mice were transfused with soft tissue cancer. 14 offspring of the cancer-resistant mouse fought off the cancer successfully, while 8 non-resistant mice did not. In another trial, 7 mice with naturally occurring prostate cancer were treated by a transfer of white blood cells from the cancer-resistant mice. By the 15th month, all 7 mice had fought off the cancer and survived, and experienced no side effects. News of this amazing discovery was reported around the world. Cancer-resistant mice had passed on immunity to ordinary mice. Can we treat cancer with a simple transfusion of white blood cells? In 2012, Munogenics tested 241 volunteers and found a significant number of healthy people that have cancer-fighting abilities very similar to that of the cancer-resistant mice. Based on these findings, a new cancer treatment strategy, termed GIFT, granulocyte infusion therapy, is now in development. GIFT offers a completely new concept for cancer treatment through a transfusion of white blood cells from cancer-resistant donors to cancer patients. The transferred donor granulocytes are capable of tracking down cancer cells and lesions for specific destruction without harming normal cells. GIFT has shown exceptional success in preclinical testing. So what's next? Currently, Munogenics is starting a new clinical trial. The donor screening phase was very successful. A high percentage of prospective donors have a significant amount of cancer-killing activity. During the treatment phase, 22 patients with advanced cancer will be given the unique GIFT treatment.
In these tough economic times with decreased cancer and medical funding, we're coming to you now for help. Your donation, whether large or small, will help us move forward with the human clinical trials needed to prove the granulocyte infusion therapy concept. If this GIFT concept is as successful in humans as it was in the mice, we actually now could be on the verge of eliminating cancer in our lifetime. And we can spare the cancer victims the heavy burden of invasive surgery, toxic chemotherapies, and harsh radiation treatments. This is a very specific, measurable goal of ours, an actual human clinical trial of both donors and cancer patients.
Why do some people get cancer and others don't? Let's find out if cancer-fighting capability can be transferred from one person to another. Your donation will help take this game-changing cancer research to the next level by funding a human clinical trial. Thank you for your support.